Anyway, BPD was added to the DSM in 1980, interestingly also the same year that PTSD was added, and it remains pretty controversial within the wider health sciences literature for a couple of reasons. Firstly, because the vast majority of people diagnosed with BPD are women. The American Psychiatric Association estimates that women make up 75% of all BPD diagnoses. Secondly, because the majority of people diagnosed with BPD are physical or sexual assault survivors, leading to questions around whether, a PTSD diagnosis would have been more appropriate. And thirdly, because the diagnostic criteria for BPD themselves are grounded in gendered assumptions of what is normal behavior, meaning some behaviors are seen as a symptom of BPD when presented in women, but not when presented in men, such as sexual promiscuity and explosive anger, both of which are pathologized for BPD diagnoses only in women. In fact, in blind studies where psychiatrists were given identical case files with only the gender changed, it was found that when the cases were labeled as pertaining to a man, they were much more likely to be diagnosed with PTSD, whereas when the gender was swapped to female, they were much more likely to be diagnosed with BPD. So this is not just a semantic issue, because the way we view these two disorders is incredibly different. For one thing, BPD is largely considered to be incurable, whereas there are accepted peer-reviewed treatments for PTSD. So essentially, BPD may itself be a kind of bullshit sexist diagnosis which pathologizes traumatized women in a way that traumatized men are not pathologized. However, even if it is not a bullshit diagnosis, the way that it is used within the legal system is repressive and essentially amounts to the weaponization of a tenuous and highly contested medical diagnosis to support arguments for further restrictions on the liberty of an individual, most often a woman.